a terrific means to improve maternal, to improve maternal and infant health outcomes. In fact, one of the first events I ever attended regarding maternal and infant health was a Black breastfeeding event in East Orange, at which a large part of the conversation focused on the immense benefits of community doulas. As trusted members in their communities, doulas have the intrinsic knowledge and understanding that allows them to provide the most appropriate and culturally responsive type of care to the mothers. With the input of doulas, expectant mothers know what to anticipate and can track the progress of their pregnancy to ensure that they are on the right path. This continuous dialogue can help mothers-to-be make more informed decisions, which in turn, 1, can reduce the rate of unnecessary C-sections, 2, lead to fewer obstetric interventions and complications, 3, decrease the use of pain medication, 4, shorten labor hours, 5, increase breastfeeding, and 6, ultimately lead to healthier outcomes for moms and babies. Last month, I launched Nurture NJ, a statewide awareness campaign that seeks to reduce high maternal and infant mortality rates and eliminate racial disparities across all health care. From symposia across the state to an incredible $38 million in additional child care grants, to private-public partnerships dedicated to tackling adverse childhood experiences, we have been working literally every angle of maternal and infant health to protect New Jersey's moms and babies. Nurture NJ operates on the mindset that we must meet the families where they are to ensure that we can nurture the lives of every mother, every baby, and every family in New Jersey. Doulas are a mother's advocate in and out of the doctor's office. They fight for the mother to have her voice heard, provide physical, emotional, and informational support to mothers before, during, and after birth at all hours of the day. Doulas meet mothers where they are to ensure they are being provided the best care possible. Since the Nurture NJ DOH doula pilot programs began last October, 54 women have been paired with doulas, and there have been 19 births. Here in Trenton, 8 doulas have supported 16 women through pregnancy, 7 of whom have already given birth. This is a testament to the needs of the community. As the closest birthing center is 20 minutes away in Hopewell, many women rely on the prenatal clinic in Trenton, which in fact is the only prenatal clinic in all of Mercer County. Improving health outcomes for mothers and infants of color requires a collaborative approach. This $1 million to implement doula coverage through Medicaid is just one part of the collaboration needed to eliminate racial disparities in maternal and infant care. We have a long way to go in fighting for a stronger, fairer, and healthier New Jersey for every baby, every mother, and every family across the state, and this is just the beginning. We are fortunate this morning to have Assemblywoman Verlena Reynolds-Jackson. I think she needs no introduction. We also have our wonderful Commissioner of DHS, Carol Johnson, our Assistant Commissioner of Health, Lisa Acer, over here, as well as a recently trained doula, Amber Dorr, right here, a recent client of Amber's and new mom, Nigeria Adamson, along with baby Journey, by the way. And a nurse midwife, Julie Blumenfeld. So thank you all for coming. My hope this morning is that we can have a conversation and that I don't need to ask a lot of questions. I don't want to pepper you, but I have the ability to do so because I have a few in my back pocket. And I thought maybe as a starting point, I might ask Amber and Nigeria if the two of you could talk about kind of how you met, how you became a doula, you know, what the experience has been like. Is that okay?
We met through Children's Futures Doula program. I trained with Doula's Future using Uzazi Village's curriculum with Mother Hakima, and that was back in October. Before then, I had always wanted to do something to help other mothers. Being a mother of 4, being a mother of color, being a mother who is young. You don't feel heard, and usually people ignore you or overlook what you have to say because they don't feel like you know enough. So that was an issue for me, because knowing that I was having the problem meant that maybe there were other mothers having this problem. Mm-hmm. And I met several young mothers who were having the same issue. So that's why I chose to be a doula. I wanted to give back. I wanted to help other people feel heard. And I met in Nigeria through Children's Future's Doula program. She was one of the first clients that came up on the table, and immediately I was just like, I want her. So, and she was almost due, and it was just like, we have a short time period where I can get to know her and create a bond and help her. And that's how we came to know each other.
Fantastic. Do you feel okay? Can you tell us a little bit about your experience in Nigeria?
The doula experience was sorry. The doula experience is amazing. Was amazing, and it still is amazing. They helped me. They helped me a lot. She helped me a lot. Mm-hmm. So it was just in this short period of time, we had a bond. We bonded, and it was just amazing. So yeah.
And just out of curiosity, how far into your pregnancy did you two meet? Do you remember? 35 weeks.
35.
Okay.
35 weeks.
Great.
Yes.
Okay. Cool. All right. So maybe before we go into some of the statistics, maybe you can help us understand the difference between a midwife and a doula and how you work together and how you see the benefits of a doula.
Hi, everyone. Thanks so much for coming today, and thank you so much for having me and bringing attention to this issue. So nurse midwives and doulas really have our goals very much aligned. We really see our relationship with our patients as one of respect, compassion, informed consent, shared decision-making. A lot of the same goals and kind of basis of the relationship that the doulas are trying to form with their clients are the same ones that midwives are steeped in from our educational background. I think part of the difference lies in today's obstetric world. I work at the prenatal clinic in Trenton. It is staffed by 11 midwives, a nurse practitioner, and 5 physicians. It's a huge staff. We do about 120 deliveries every month. Wow. And we are there 8 hours a day, 5 days a week. So you can imagine the amount of time we have to build a relationship, as much as that's the basis of our education, why we became midwives, what we want to do. It's very challenging with the acuity of the medical conditions that exist in the patient population, with the language barriers, with the cultural differences. It's a linguistically and culturally extremely diverse population with a lot of social issues. And so the amount of time we would like to dedicate in terms of relationship building and things that the doulas can do, like going into the patient's home, really forging that relationship and going to their homes after the birth and maintaining that relationship with them and spending the hours and hours they can with them during the labor, that when we are managing multiple patients at the same time in the hospital just isn't possible. It's sort of like our ideal person to be there with them. And the midwives in our practice have talked about for a very long time how great it would be to have doulas in our service. And when we learned about the program, we were thrilled. And I think that Amber can attest to the fact that, we have welcomed them warmly. We are so glad to have them at Capitol Health with our patients and really see them as a huge asset to our practice and to the care that can be given to our patients.
Thank you. Assemblywoman, you have been a champion for infant and maternal health here in Trenton, and I wonder if you can share some of the issues that are specifically impacting Trenton.
I think part of it is when I first got here, and you, First Lady, have been very out in the forefront of all of this. I didn't realize that when Capitol Health left, the city of Trenton, that there were no births being occurred here in the city. And so when you start to think about the barriers that we have in terms of transportation, just health care in general, how do you, the food deserts that we have, just trying to be a healthy mom, and then all the barriers that come along with it, it was heartbreaking. And then when you look at the numbers and you see how we're losing our children, I was compelled to do something. And so to find out when you first came in, this was one of your missions, I was like, this is a great partnership. How great is it to have the First Lady be your advocate on these issues? Also in the New Jersey Legislative Black Caucus, it's been a major item on our list of things to tackle for years. And so now we have this partnership, and I think this is bringing light to it and resources. So for us, it's about making sure we combine the two together and making sure that moms and families and dads, can be able to have a healthy baby at the end of the day. This is what we want to be able to do here in the city of Trenton. So thank you, and thank everyone around the table. When I first came in, I saw so many faces, and I say, if I'm around all of these people, I know I'm doing the right thing. When we keep meeting and we keep talking about how to bridge the gap together, we are definitely making progress. So I can't wait to have this follow-up conversation a year from now to see how we've improved.
Great. So maybe Lisa and Carol, I could ask a question of both of you. So there are a number of great programs across the state of New Jersey, aside from the Doula program, that have proven to reduce maternal and infant mortality, ranging from centering and home visiting programs. I wonder if you could help us understand from your vantage point how doulas will specifically further improve maternal and infant health.
So I'll go quickly, and then Lisa, who has spent so much time over the past year really helping to build the pilot program and get us to the place we're at today, to be able to say that we're going to cover these benefits under Medicaid, is thanks so much to the work that Lisa has done. I just want to start by saying it was about a year ago that we were here in the same room where we started this work with Congresswoman Bonnie Watson-Coleman really helping to lead the charge. And we've been so fortunate in our state to have the First Lady's leadership to really galvanize our policy agendas at the Department of Human Services, at the Department of Health. And you can have no greater advocate in Trenton than the Assemblywoman, who is at every turn fighting for the right policy options here. And I'm so grateful for you for sharing your story, because it makes such a difference. And I suspect that you will motivate others to do the work you do. So thank you for that. I just want to say that, so I run the Department of Human Services for Governor Murphy. It's really my honor and privilege to do that. And we are thrilled that in the governor's budget this year, we are proposing adding doula coverage to the Medicaid program. It is long past time, as those of you in this room know, for us to be really putting the resources and support behind the women who are doing the work. And ensuring that we get the best possible outcomes. We want to be a Medicaid program that's about good health outcomes, not just about paying bills. And so we're so delighted to be doing this. And as the First Lady said, this year's budget is $1 million, but that's our estimate of what we'll spend as we ramp up this year. The key thing is that we're building the benefit into the base Medicaid program. So as more doulas are trained, as more doulas are available, we will continue to pay for these services. So we're really excited about that and the growth that we will see over the years ahead. As the First Lady mentioned, it builds on all of the groundwork that everyone in this room has been doing for several years, ensuring that the health system and our partnerships and the plans and and other payers are really doing the work together to make sure that we identify where there are gaps and we're filling those gaps and that we're getting to the best possible outcome. Home visiting is a key part of that. Our colleagues at the Department of Children and Families and the Department of Health and the Department of Human Services, we all work together on expanding those services. But that moment of birth, the lead up and the time after birth, it's so critical. And having the support you need and knowing that you can get reimbursed for the services you're providing is what we're aiming to do. And we're really looking forward to working with the legislature to make sure we achieve that.
Great. Thank you. Lisa.
Thank you. I will add on, I think it's great to be on this panel. These are real champions, and this is really a great day. I work in the Department of Health, and as they mentioned, this has been my work forever, for the longest time. To have the First Lady here as a champion, to have Assemblywoman here as a champion has made the work even that much more meaningful and has really helped accelerate some of our efforts. In terms of why doulas, as compared to centering or as compared to some of the other initiatives, it's all about social support. You know, when we retooled this initiative about a year ago, we said, let's go back to the drawing board and let's really talk to the women, talk to the community health workers, and really figure out what the issues are. And time it came up that it was social support. It was a lot of the social determinants of health, things that are not medical. So not just access to prenatal care, but really transportation, housing, child care, food. And so we decided, you know, we needed to do something that really allowed us to provide that social support. But it wasn't just a typical doula, it was a community doula, because we really wanted doulas to be able to address those social determinants of health. So we have really trained them with a curriculum that is community-based, that is rooted in addressing the social determinants of health, that is rooted in health equity, because we realize that it's more than just the clinical stuff, it's everything else. And so to have Amber here, to have Nigeria here, to have Baby Journey here is wonderful. Because you can see it's not a relationship that sort of begins in prenatal care and ends in delivery. It's a relationship that continues far beyond that, and that is what we need to address things like infant mortality and maternal mortality. So I am just thrilled to be here, thrilled to hear these announcements, and thrilled to have been a part of this. We are piloting this work in 4 cities, in Trenton, Camden, Newark, and Atlantic City. There are many more places that are in need of this. With this additional funding, we can do that. We can sustain our efforts. We've done this with sort of public and some private funds, but to have Medicaid come to the table is just tremendous, and we are so grateful. So we'll keep doing the work. You know, we can all continue to think of solutions, but it's just a great day. So thank you, First Lady Murphy.
Of course. You started to touch on this. Do you think you could explain exactly what the difference is between just a regular doula and a community doula? Since a community doula brings so much to the table?
I can. I think a community doula is really the integration of a doula and a community health worker. It really is a doula that is trained to do doula work and much more. So part of the training that we provide them is around health equity, is about just some of the history in terms of some of our policies. Social determinants of health, where you go to help a client get WIC, how you can get emergency housing through the programs in Carol's department, how you can get food through SNAP-Ed, you know, how you can get emergency heat or appliances through DCA. So we're really trying to give them much more of a holistic approach and really make them sort of jack of all trades. You're certainly going to help in the delivery and the sort of prenatal and postpartum, but you really can help families become self-sufficient and get the things that they need. So it's really exciting. It's really exciting the work that we're doing. It's really exciting to have all of these diverse partners around the table as well.
And I think it's about the long term, you know, with the community doula, and it's not just, you know, a one-stop shop. It's holistic. It's all around. It's all encompassing. And Nigeria said it. You know, they created a bond. They have a lifelong, lasting relationship that they created through this doula program, and I think that's really, really important. And you talked about, you know, housing and food, and you know, they're the advocate in the doctor's room with you. You know, sometimes we go and we talk about it all the time. We're not sure what to ask. Even if you're a first-time mom, you have no idea what you're experiencing, but you have this partner with you that you know got your back. They are there to help you and support you through this whole process. So I think that's another huge plus in making sure that these birth outcomes are more successful.
Fantastic.
I just pick up on something Amber said about feeling like your voice isn't always heard and having an advocate to be able to make sure that that happens. It's just so critical. And if we're going to get to better outcomes, that's what we need.
Carol, can you walk us through what we have learned from other states and how that's going to inform what we're doing here in New Jersey?
Absolutely. I mean, I will say there are only a very small number of states that have added doulas to the Medicaid program, so we will be sort of at the forefront states that are doing this, which we're really proud to be doing. I think we also want to make sure that we build a program that works for New Jersey. So we want to make sure our Doulas' voices are part of that conversation. So we will make sure that we do those kind of conversations as we work to build it. But we've learned that how you build it is important, what the set of services are, how long the timeline is, those kind of things matter. And so we want to do that in a collaborative way.
Great. Nigeria. If you don't want to answer this, we can ask Amber. But I'm just curious, with all that happened with Serena Williams and Beyonce, I just wonder if your experience was difficult, and if there's anything that you can share with us about your actual experience, as we all have that in mind, because that got a lot of publicity.
Well, not during birth, but like just in general. As a first-time mom, I feel like I'm dismissed because I'm like to older people, or sometimes even younger people with multiple children. They just be like, "Oh, you're a first-time mom. Like, you're a first-time mom. You can't like do this," or they just tell me like what I can't do. Like, so it's just like, okay, I'm gonna do what I have to do, but like, I don't know. It's just,
No worries. That's great. That's great.
So I just feel like sometimes, as a first-time mom, like I'm not heard enough. Like I'm not heard. My opinion is not counted for because I'm a first-time mom. So yeah.
So it's more being a first-time mom than
Yeah,
anything
or
else.
maybe
Okay.
like not. I don't know. Oh my God.
That's okay. No worries.
About your labor, how she was there with you in your labor.
Okay. The labor part was, great, but it was great. It was a great experience. It was a great experience.
Let's hear how great it was.
Why is everybody laughing? Labor was.
She was there with me.
Yeah, it was an experience. She was there
Yeah.
with me.
It's an experience.
How long?
How long was your labor?
How long was it?
So, the experience in itself was, she went into labor, her membranes ruptured on January 1st. You gave birth January 2nd. At around 8 in the morning, right?
8:40.
Yeah, there
To
we
be
go.
exact.
8:40 in the morning. It really increased around midnight is when she really started to have contractions, and she was
Those
uncomfortable.
contractions hurt.
And that in itself, so the day of January 1st, I took her to the hospital. I stayed with her for a few hours. She had family coming and going. There wasn't any real progress with the labor at that time. She wasn't having contractions. She was only 2 centimeters dilated, and she should have went to sleep, like she said. But she had family, and the experience wasn't just for her. She had her family there and friends to talk to, and so I left for a couple hours to give her that time, because that's her time. This labor is about her. This birth is about her and her baby. It's not about me being there for that portion of her talking to her family. But as the night settled in, I came back. I had my bag packed. I'm like, all right, we're ready. We're gonna do this. And she thought she was gonna go to sleep at around 11, almost midnight, and that's when the contractions started. And I tell everybody this, but for me, it meant a lot to be there for her. Giving her those resources that she had, she thought she could only have an epidural.
Yeah.
She didn't know any other pain management techniques before we went into labor, and we had a discussion about it. We went over her options and how she could still have it as natural as possible, and she stuck to her birth plan. Now, with that being said, she did amazing.
Mhm.
Like, she was, I mean, this was the best experience by far that I've ever had with somebody in the delivery room. So, and this was literally my first experience on that other side where I'm her support person, not somebody supporting me. So, coming from that perspective, just being there for her was a lot. And it helped. It made a difference for her. And she's been exclusively breastfeeding the whole time. She stuck to what she wanted.
Yes.
We talked about this on the way over, how it was just such a big thing to breastfeed, and the importance of it, right? Like, a lot of people shy away from it. A lot of new moms shy away from it. A lot of black moms shy away from it because we're taught that it's sexualized, that we can't do this in public. We can't feed our children, which is ridiculous.
False.
But
It's false.
false, yeah, right? Like, you know, you get a lot of backlash for feeding your child in public, but if it's a bottle, it's okay. We've been doing it for years this way, so there's no reason for that to have to change. And she's been doing great with that.
Amber, could you talk about your relationship with medical professionals and how we can build on that in some way for doulas?
I think that goes with all relationships, that communication is important. As far as the midwives, Julie, specifically, I had her that night. So communication is important. Every time I go into a hospital, I introduce myself. Hi, I'm Amber. I'm her doula. So that way they understand our relationship and they don't just think I'm another guest coming in. Because then they understand that they can talk to me if there's a concern, or I can talk to them if there's a concern. Like, if she's uncomfortable, they understand that I'm not coming from a point of view where it's like against them. We're together. So I've had a great experience with the midwives.
Fantastic.
Can I just go back to your PowerPoint just for a
Please.
second? I don't think this needs, I'm 100% sure this doesn't need to be said in this room, but just for the larger audience, if Serena Williams felt like her voice wasn't heard, who can deny that women need this support and need this advocacy during this critical time in their lives?
Good point. Before I give any closing remarks, does anyone have something that you wanted to touch on that I haven't asked about? Is there anything you want to add? Lisa?
I'll just add that we have, through Healthy Women, Healthy Families, trained 50 doulas already.
Right.
Through this initiative, but that by no means speaks to all of the doulas in New Jersey. But we have trained those 50 doulas to be community doulas. We have in the pipeline another 50, another cohort that is coming up that will address some of these issues in many of the other cities. And we have trained some of our doulas to be supervisors, so train the trainer. So I'm saying this to say that the money is great. This is fantastic. We will be able to sustain our efforts, but we are building the capacity as we speak so that there will not be a shortage of doulas. The money is there. There will not be a shortage of doulas throughout the cities. The data tells us we need to work in first and hardest. So I just wanted to put that out there, that we have a trained cadre of doulas waiting and ready to assist in addressing this issue in New Jersey, and it's something I'm very proud of. And many of them are here in the room with us, so it's just phenomenal. Yeah.
Sure. Who
Can
are
the
can
doulas
the doulas
stand?
stand up?
Doula? I see one in the back.
Oh. Yeah. Great. Anyone else want to add
Yeah, I
anything?
guess I just
Julie?
want to just to add to what Lisa said, that from the midwife's perspective, and as much as we're so thrilled to have the doula in the labor room and in the patient's home, that it's as much about the doulas as it is about the women that they're serving, right? So we see from our perspective the doulas as a community development strategy, right? So it's about building community. It's about what the doula is giving to the patient or the client, but it's also about what the community or the state is giving to the doulas from the same community, which I think sometimes gets a little bit lost in the conversation, but is an essential piece of the entire initiative as well.
Okay, so I think I'm going to just give you some closing remarks, and then we can open up to some questions from the audience. So if any of you have any questions, we'll take those in a minute. First of all, I was exceedingly remiss at the outset, because as I walked in here today, and as Carol so aptly referenced, Bonnie Watson Coleman held a roundtable here about a year ago, which was one of the first things that we did. And like clockwork, I literally opened the door to walk in here, and I got a text from Bonnie Watson Coleman and from our great Commissioner of Health, Sharif El-Nahal. They are together in Washington, D.C. right now. So I just want you all to know that there are lots of people who have a vested interest in making sure that we succeed, and those two are right at the forefront. So, okay, so...
Oh my God.
Welcome, Junior.
Oh my God.
Okay, Journey.
It's her moment.
Journey, not Junior. Journey. Okay, so I wanted to also just go back because there were some statistics on Trenton specifically that I wanted to just share with us all because, you know, obviously Lisa and the Department of Health and Carol's team have selected these 4 cities for a reason. And I think if you look at Trenton, you can understand why it's so important here, and it will help you understand around the state. So in Trenton, the black infant mortality rate is 9.7%, which is one of the highest in our state. 28% of Trenton's population is in poverty, 16% unemployment rate, and 30% are uninsured. The median income in Trenton is $34,412, which is less than half of the median income across the state. And in 2017, this is the other piece about the community aspect. In 2017, there were 540 births to black women, 716 to Hispanic women, and 86 to white women. So Trenton really does need this, and I think we all understand why that's the case. So I think we've heard some great testimonials as to why it's important. I think that we also understand that it's scalable, and I think we're all locking arms together, both within the administration and across the community. And I think that this is really great for New Jersey, and I'm really excited about it. And thank you all for participating.
Thank
Yeah.
you.
So with that, would anyone like to ask questions of anyone up here on the panel? Yes, please.
Actually, have a couple of questions. My name is Debbie Polachak, and I'm from the New Jersey Family Planning League. And I had a few things that I was curious about. Number one, how do the women get connected to the doulas? And then the next is, are the doulas specifically out of particular health centers, or can OBGYNs in the community who maybe accept Medicaid, will they be able to access the doula services? And I did want to ask Amber, when you go in with a birthing experience time, is everybody aware of what a doula is and what you do, or do you sometimes find yourself having to explain to healthcare providers exactly what it is?
I've had to explain to some nurses who don't immediately know what it is, but as soon as I start, they're just like, oh, that's the name for it. So they understand what it is, but the name gets lost in translation somewhere. As far as how we're paired with our clients, logistically, I don't have all that. June does. June, if you want to answer that question.
We get our referrals from the prenatal clinic. We also get referrals from our outreach with our community health workers. We get referrals from people just calling in. They've heard about the Doula program. We've done lunch and learns or outreach to different areas where women probably like students, especially college. So we've been able to interact with them. We've had meetings with the doulas the midwives programs. We had a lunch and learn with them yesterday. In December, when we first started the program, we had a tour of the labor delivery rooms and out at Capitol House at Hotel, so the nurses know them. And then I think you asked what was the other question.
Well, actually, one of the things I did want to know is, I guess, like, if there's a woman in the community, can she call and ask to be compared? And if there's a physician in the community, can he call and ask to have a doula to be paired with one of his clients?
As I said, when we get our referrals, they come through the SPEC system. It's a system of central intake, so we get the referrals that way. And then we try to connect with the clients. We call them as soon supervisor calls them, if they have any other, and the doula goes out. If the doula and the mom has any other concerns, like housing or something like that, our community health worker also can go out and help them. So it's not only the doula, the community health worker, everybody working. Sometimes they have issues with housing, sometimes they have issues with transportation, other things like that. So we've been able to help them.
So maybe you can tell them who you are. Right?
Okay, I'm sorry. Sorry. My name is June Gray. I'm the Director of Family Support here at Children's Futures. We have a variety of different programs here. We have the Nurse Family Partnership Program for first-time moms. One of the reasons why Nigeria wasn't eligible for the Nurse Family Partnership Program, she was past the parameters of the program. So she was 30-some weeks. So she wasn't eligible for the Nurse Family Partnership Program. We have 8 doulas that go out into the community. All of them, I think we've done probably 7 or 8 deliveries.
We also have 8 Healthy Women, Healthy Family grantee organizations that are throughout the state, and so we've covered the state in terms of all of the regions. And so any one of those grantees can certainly direct you and identify doulas that are available for you. But I think, as June said, we, the Department of Health, partner with Department of Human Services, Department of Children and Families, Education, Labor, and Workforce Development. So they're all aware of the services that we provide. So our goal is really to sort of publicize and advertise doulas as much as possible. And as I mentioned earlier, make sure that we have doulas available to serve those families.
Yes, please. Can you tell us your name when you stand up?
Hello, my name is Jay Madden Wilson. I'm the Community Health Nursing Supervisor for Greater Newark Healthcare Coalition.
Oh, good.
I'm also the president of Melanated Mom. So I'm here because we're one of the 8 recipients of the Healthy Women, Healthy Families grant. And we have great community health workers that are serving a lot of women. My question is, as you guys are building this program, as you ladies are building sorry about that. As you ladies are building this program to integrate doulas into the medical care system, do you have a development plan with certain hospitals or birthing centers to make this like just as normal as a nurse would be a part of the healthcare team for birthing?
Yes, yes, and yes. It's a great question, excellent question. I'm thrilled to see you here from Newark. Thank you for being here. But we are talking to ACOG, American College of Obstetricians and Gynecologists. We are talking to the clinical community because it's really important that we break down the barriers and kill the silos. You know, you have to know each other and have to know how you complement one another. We have medical champions in this work. Tom Westover comes out of Cooper Hospital and has agreed to sort of be the pioneer and take the first step in terms of creating a conversation between his clinical community and the doula community. So coming soon, we're starting in South Jersey. We will get to North Jersey. We have champions in the room that represent North Jersey, like Jill Wadnick behind you, who is esteemed in this work. But we are beginning this conversation in many places because it has to happen. So thank you for asking that question, and it's something that we're actively working on.
All the regions. I think all of the doula pilots I know in New York, we meet with the physicians, we meet and have meetings, and we try to do it quarterly. Fantastic. So that's another way is directly having a doula at the table with someone who's in administration and so forth. I think that also to that conversation in the moment really matters also.
And we want to get to a place where that referral happens as early as in the pregnancy as possible, so that support, it comes as early and is able to get the best possible outcome.
And that's why we do pre-pregnancy testing. So when somebody comes into our agency or calls and say, you know, I think I'm pregnant, I want to do a pregnancy test, in order for them to be admitted to the prenatal clinic, they have to have a positive, you know, documentation that they've had a positive pregnancy test. So when they come in, we talk to them about, you know, if you want to go to the prenatal clinic, we actually help them go to the prenatal clinic. We provide free bus tickets for them to get to the prenatal clinic. And once they're established in the prenatal clinic, then we can ask for that referral back so we can follow that woman. You know, we hopefully get them within that first trimester.
Sorry, can you introduce yourself? I'm sorry, I know, Rachel, we didn't hear how you're affiliated either, so.
My name is Phyllis Greer, and I just wanted to ask, are there a certain age limit where you start and cut off?
don't
I
think
think
so.
18. 18. So if you're,
June says it. It's 18 now. Okay, June.
And we have doulas of all ages because, we need to make those appropriate connections with people. So we have some young doulas, and then we have more seasoned folks like myself. But we have all ages because it takes, all types of people to work with people.
Great. So we're going to take one more question here and then one more after that, and then I think we'll wrap up. So please.
Thank you. I'm Sheila Rennerton. I work at NJPP, the Policy House, and I work on tax and budget issues. I'm also on the steering committee of a reproductive rights statewide coalition, Drive New Jersey, and I was a doula for 8 years in New York City. So this is the best morning ever. Okay, so three things I'd like to say, and I'll bring it as fast as I can. Doula work is backbreaking. Yeah. It's backbreaking work. We know this. So I really can't emphasize enough that the reimbursement rate has to be fair. The idea of being a community health worker and a doula is a tall one, considering that it's backbreaking work. So this idea that you can combine the two and be in be-all, end-all, then the reimbursement rate better be great. And then this is women's work. It's usually undervalued. We can see that in the home health services, home health aid services. We can see this in childcare sectors. We don't want this to be another sector where women are emotionally invested to what they do, but they're not paid well. So I can't emphasize enough how important it is that this great pilot program, $1 million is not a lot of money. I would love to see these doulas being paid by the hour, not by client, because some births are 2 hours, some births are 37 hours. And the amount of emotional work that is being done for these women is a lot. So I cannot say enough how important it is that we pay this work for what it deserves. Thank you.
Okay. Please, a doula.
Good morning, everyone. My name is Elena Broach, and I am from Doula Services, but I am in partnership and the doula supervisor with Children's Futures, and we have collaborated. I have been within the community now for over 18 years, servicing the city of Trenton for families of color as a doula and doula mentor. My question is, doulas are also community doulas. We are a historical part within the Black community or communities of color. So my question is, as we are formulating the plan of, recruiting more of us and for Medicaid, will it be considered equitable, like equitable means for us to get the training and so forth? Like when Medicaid is put into place, are you going to consider, for example, there are other training certification programs out there. It costs anywhere from $300 to $600 for some of those certification programs. For those of us in the community, that would be a hardship to then go for certification. So it's just keeping in mind that there's two streams of different types of backgrounds, and when you're talking about us in the community, you want to make it equitable. You want to make training or continuing education for us equitable, and not make the bar too hard for us to be able to get the certification. Or every year where we have to recert, put out another certain amount of funds.
We've got good news for you. Lisa, you want to go?
We have great news for you. I think with this Medicaid partnership, this is the sustainability. Because what we're doing now in the pilot is we're doing it all. We're doing the training and we're doing the compensation, right? The reimbursement for the births, and we're doing it with public and private funds. Not sustainable. This gives us the opportunity to focus our efforts on the training and the capacity building and the continuing education and all of the things that you've talked about, understanding and knowing that Medicaid, a public partner, has really stepped in to pay the other half. So we are thinking about this together. Carol and I and My commissioner, Dr. Sharif El-Nahal, and our teams have been thinking about this tirelessly. I stay up at night thinking about this. But we are planning for the long-term sustainability to exactly talk about and get rid of the barriers that you've talked about. We want to bring more people into this, not less, and we want them to have a livable wage as well. We don't want to reinforce the same stereotypes and the issues that have kind of plagued us throughout.
And Lisa is our fierce advocate at that table, as she should be, and she brings all of that expertise and experience with her. We need the governor's budget to pass. So that
Details.
we,
First Lady will handle that for us. You know?
I got it.
and we intend to work as collaboratively as possible on the development of this benefit.
Sure, I was supposed to introduce my name is Phil, Dr. Phil Goldwright. I was supposed to introduce the First Lady of the state, and you just went right in.
I'm so sorry. I'm
No,
sorry.
but I didn't want you to come in and think that we certainly don't appreciate the work you do. But on behalf of Children's Futures, I serve as the chairman of the board, and we want to thank you for taking time out and to tackle this very important topic. The statistics, speak to the fact that this is absolutely needed, and we certainly appreciate all of you for coming as well. Thank you so much. We believe in fulfilling the promise and making it possible for everyone, every child born in this city and actually state to have an opportunity to have a great outcome. Thank you so much.
Thank you. Thank you, and thanks to Children's Futures again. Okay. All right, thank you all so much for coming, and stay tuned. We're trying.
It's a pleasure.
Great.